Hi guys, Dr. Tony here with Off the Block Physical Therapy. So today we're going to talk about what you can do to modify your different lifting patterns if you deal with back pain while you lift. So, as many of you have probably seen or even trained before, the standard deadlift goes from the floor, your feet are hip width apart. The idea is to kind of drag that bar up the front of your legs and lower it back down while you keep your back nice and extended. Squeeze through the glutes and then hinge back down, right? So right here, feet hip width apart, start with your hips down. You're gonna pull to about mid-shin and then hinge up and then hinge your way back down and drop into the hole. So that's your standard deadlift. But sometimes you may have pain and it may not be the type of pain that all you have to do is take some weight off and go on and do your normal repetitions. So I wanna show you a couple of ways to modify that today, so that if you're having some pain while you deadlift, you don't have to completely stop deadlifting, because we know that that's not the best way to get back to deadlifting, but rather just to modify while you manage your pain and then move back up towards real, true deadlifts. So the first option is that you can start with an elevated weight here. So just like little mini deadlifts. So you're gonna start right here. You're not lifting all the way from the floor. You're using good form. Partial deadlift right here. Keeping that arm form nice and good. Up and down and all the way back to the floor. Or another option entirely is that you take the big bar out of it completely and you use dumbbells. So the way that you can do this here, you can actually keep these dumbbells way closer to your center of mass than you do with a big bar. The big bar, you have to be way out here, or I mean relatively close, but it does have to be farther out. With a dumbbell, you can stay nice and close, work through that full range, and then come back up. And it makes it easier for your back muscles, if they're weak or if they're in pain, to move towards modifying the way that they activate so that it's no longer painful, keeping that weight nice and close to your legs. So those are two really good modifications if you are deadlifting and you're having some back pain. Catch up next week. We're actually going to talk about a similar concept, having back pain while you do another lift. So tune in next week.